I'm Baratunde Thurston, and you're watching Clarify. This is the show helping you make an informed decision on the way to the polls, and we're sharing some music for thought for the ride. Today, we're sitting down with Bethany Cosentino. She's half of the band Best Coast, and we'll be talking healthcare. The Affordable Care Act and reproductive healthcare have become some of the most polarizing issues in national politics. And in this episode, we'll dive a little deeper into both issues. First, let's take a look at the reproductive healthcare debate. Abortion is a constitutionally protected right in the U.S., thanks to the Supreme Court Roe v. Wade decision in 1973. But American opinion is still divided on the issue. 56% of Americans say abortion should be legal in all or most cases, while 43% say abortion should be illegal all or most of the time. This tension might explain why states have passed 1,074 abortion restrictions in the year since Roe v. Wade, even though the abortion rate has been declining for decades. That coincides with a national drop in pregnancy and birth rates. Anti-abortion members of Congress argue that organizations like Planned Parenthood should be defunded. But the 1976 Hyde Amendment already prohibits federal funds from being used for abortion, except in extreme circumstances, for example, in cases of rape. It's unclear whether the anti-abortion versus pro-abortion rights debate is more political or more ideological. Whatever your view, remember the next president will appoint at least one Supreme Court justice, which could impact the future of reproductive health care. Now, let's catch up with Mike's Luke Brinker to talk more broadly about the state of healthcare coverage in the U.S. I'm sitting here with Mike politics editor Luke Brinker. We're going to talk about healthcare. What's up, Luke?
How's it going?
Good to see you again.
Good to see you.
So I want to start with Obamacare, which has a nice ring to it. But could you describe the health insurance world before and after, and just talk broadly about what the major pieces of Obamacare actually are, other than a word that people like to yell at?
Sure, absolutely. So one of the things that people might not realize is it's not actually called Obamacare. It's formerly known as the Affordable Care Act. It sort of took on the moniker of Obamacare, and it was originally sort of a pejorative term that people who did not like the healthcare law applied to it. And then as Obama sort of progressed in office, he was like, actually, this is something I'm proud of. We're going to call it Obamacare. So now everybody calls it Obamacare. But what it was in response to was essentially a health insurance world that people saw as sort of the Wild West. You know, you could be discriminated against by health insurance companies if you had a pre-existing condition.
Meaning if you were sick before you
If you were
got
sick
insurance,
before, you know, say you'd had breast cancer before. You know, health insurance companies were entitled to charge you much higher premiums than they would somebody who hadn't had any illness before. And the United States was, you know, sort of alone in the industrialized world in having no system of universal health insurance. This was meant to sort of address that. So the mechanism for addressing the lack of health insurance was an individual mandate, which essentially means everybody has to purchase health insurance.
Like if you have a car, you have to purchase car insurance.
Exactly. And whereas before the healthcare law was passed, there were about close to 50 million people in this country who lacked health insurance. We're now down to, I think the latest numbers are somewhere in the range of 15 to 20 million who lack it. So not everyone has taken advantage of the healthcare law, and there are sort of carve-outs to the individual mandate. If, you know, for religious reasons, you object to purchasing health insurance.
Who are some of the groups of people that have insurance now that didn't have it before?
Very poor people had Medicaid before. Seniors had Medicare. What this law was really sort of meant to address were those people who were too poor to afford individual private health insurance, but made too much money to qualify for Medicaid, which in a lot of states has a very low ceiling on the income that you can make to qualify. So it's lower income Americans who didn't qualify for Medicaid who have been some of the biggest beneficiaries of this law. It's sicker people who did not have access to the health insurance market because of pre-existing conditions who now cannot be discriminated against. And it's primarily older people. Some of the struggles have been in getting younger, healthier people to actually sign up for these insurance markets, because the way they look at it is, I'm young, I'm healthy, why should I have to pay an insurance premium if I'm not actually going to be taking advantage of this healthcare policy? But certainly the groups that were most in dire need of assistance have access to it now.
What about the expansion of coverage for those young people to ride off of their parents' plan for longer. Did
Exactly.
they raise the age for that?
That is one of the more popular provisions of Obamacare. And, you look at polling, oftentimes there's a little bit more opposition to the notion of Obamacare, but there is broad popularity for some of its benefits, like not discriminating against people with pre-existing conditions.
Well, it's like people love roads, but not taxes.
Exactly.
Right? Like they don't always make the connection.
I like the concept. I don't like to actually have to pay for it.
Yeah.
But another one of those popular provisions states that young adults can stay on their parents' health insurance policies until they're 26.
I was recently overseas myself in Spain. My girlfriend broke her ankle. We were not charged anything to get x-rays and also treated like human beings, shall we say. The real pain, other than the physical injury, was the insult added to the injury by the US insurance system. 6 hours on the phone, every doctor in the States that she dealt with, and all of their reports asked about her insurance. So why can America not be like Canada or the UK or Spain or France? These are not third world countries, all flailing under the weight of their governments and corruption and all these other stereotypes we have. What's holding us back from being able to achieve that level of simplicity?
It's really a sort of a complex set of cultural and historic factors. And just sort of pragmatic concerns. A lot of people say, look, if we were to design a system from scratch, we would go with a single payer model. Obama has said that before, Hillary Clinton has said that before, but they're not proposing that because they're like, well, we have a private insurance model that's profit driven, and that's sort of the reality we have to deal with. We can sort of reform around the edges, make it a little better, make it better for consumers, but we're not going to be able to overnight upend the system as it exists.
Because that would be a revolution, essentially.
It would be a revolution, which, Bernie Sanders, the political revolution, he was all about that. And a lot of people, I think, have rallied to that position. And I think potentially he helped move the debate in the direction of a single payer system. It's become something that has a lot more support within the Democratic Party. And I think the more you see that become part of the political discussion, then maybe we will be looking at a situation in a few years where more Americans are like, okay, maybe it does make sense to have more of a public role in healthcare. Maybe this isn't something that should be driven by a profit motive. But it's also a matter of, the sort of cultural norms that we have around doctors, who think that, I went through this long slog of medical school. I have these insanely high malpractice insurance premiums that I have to pay. Therefore, I'm only going to accept insurance policies that compensate me very generously. And so that makes healthcare more expensive.
And that also creates this patchwork of covered versus not covered, or in-network versus out-of-network.
Exactly, which is one of the issues that you would potentially run into with a public option, was making sure that this is something that doctors would actually accept, that compensated them at the right level. But you also have to think about, okay, is this something that's going to bust our budgets? And that's always sort of the give and take that you have with healthcare, and it's why it's definitely not a simple, neat solution that we're looking at.